Welcome to another Anatomy Whiteboard walkthrough. In this video, we will walk through the coronary arteries and their branches, and then I will relate those arteries to the veins that run with them, and give you an easy way to remember those relationships. If you don't want any review of the heart anatomy to get oriented, skip to the 3rd minute of this video, and I'll start going through the branches immediately. For everyone else, we're going to start by orienting. First things first, let's get oriented. This is our anterior version of the heart. This is our posterior version of the heart. And we're going to talk coronary arteries and cardiac veins. But to start off, we got to label everything. And this is a little bit of a review of the anatomy. First thing I want to do is point out the apex. The apex is the tip of the heart. It should always point to the left. Some hearts look different than others. Some are more rounded. Some don't have much of a tip. But our heart in anatomical position points towards our left side of the body. So that is our apex. So we have great vessels. Let's cover them. We have a pulmonary trunk here. The pulmonary trunk in the anterior view is going to crisscross with the aorta. So the pulmonary trunk is more in front, anterior to the aorta, which is just posterior to the pulmonary trunk. They crisscross in the front when it is anterior view, and that is something you can look for, is a crisscross versus the backside where there won't be one. And of course, apex to the left. Never just use one thing. Always use multiple things. So we got pulmonary trunk becoming pulmonary artery. We got aorta and its branches. RBC for right brachiocephalic. LCC for left common carotid. LSC for left subclavian. This would be our SVC. This would be our IVC, which stands for superior vena cava, inferior vena cava. Two veins that go into this structure, which is our right atria. Over here, we can see a little blip of our left atria. These little structures, there are 4 of them, are our pulmonary veins. All right, let's do the same thing over here. This is aorta from the back. This time, we switched left and right. So that's aorta. Notice it's chopped because it would have come right through this picture and covered up our whole heart. So we cut it off so we can actually see it. So now we got our 2 pulmonary arteries. I could put in which direction. This is left. This is right, just so we remember. Then we got our left pulmonary veins, right pulmonary veins. What's this structure then that all the pulmonary veins are going into? That's got to be our left atria. We're going to talk about the structure underneath it. I'm not going to label it yet. And then we have our ventricles down here, apex down here. These things have to be our IVC and our SVC, which means this little area in between must be our right atria. Now that we're labeled, now we can get into the coronary vessels. So in our aorta is the aortic semilunar valve. This is this valve. It's got 3 little cups. 2 of those cups have little openings in them that are actually going to connect directly to and be the source of our right and left coronary arteries. So when blood is pumped out through the aorta, up into this vessel and spreads to the whole body, some of that blood is caught in these cups or cusps and is going to drain directly into our right and left coronary vessels. In this picture, this would be our right and left coronary. Like you're having a coronary, that's what this is referring to, the vessels that supply the heart. And these are both arteries. So the origin story of our left and right coronary arteries is that they originate from the aorta itself off of these cusps of our semilunar aortic valve. So now we're going to put all of the branches of our coronary artery into these 2 pictures. So let's begin. Our right coronary artery comes off the right aspect of our aorta. So it's over here by our right atria. So it's going to come off of the aorta itself and then run in between the right atria and the right ventricle, just below it. That's where you'll always find this right coronary artery. Now, just a pro tip, if you're dissecting these out and you don't see them, start at the aorta. Pull stuff away from it, look for the source of those arteries, then trace them out with a probe. And kind of use the probe on top of those arteries to feel them out. Now, the first branch of our right coronary artery is very, very important and is one of the many reasons why the right coronary is special. So the right coronary artery, the very first branch, it's not very big, but it's very important and sometimes shows up on lecture exams because of its importance. The first branch, and I will put a 1, We'll make a list down here. The first branch of our right coronary artery is the sinoatrial nodal branch. You can shorthand that to SA nodal branch. So the very, very first branch of our right coronary artery is the sinoatrial nodal branch. Why is that so important? Because this SA node and the AV node, which it also supplies because it gives off a branch that we never really name. It just goes to the right atria near the valve. That branch is going to supply your AV node. But the reason it's important is because the SA node starts the signal for conduction of the heart. So that signals your heart to beat. If this does not have blood, you have a big problem on your hands. So very important to know where this branch branches from, which is the right coronary artery, not the left. So right coronary artery, and I'll put a little note, AV node, usually, not always, supplied by right coronary artery. Usually, not always. These are very variable. We will get to that. So, first branch, sinoatrial nodal branch. Very small, hard to find. If you find it, great. That's fantastic. This is more of a lecture-based sort of knowledge question though. Next branch, the first one that you definitely have to identify, so we'll call it branch 2, is a branch that runs down the side, the right side of your heart, right along the sides. I don't know if this will be an old example or if it won't hit home, but the margins of a page, when you're looking at a Word document, think of the margins of the heart are the sides of the heart. So marginal artery. And this one is specifically the right marginal artery. Right marginal artery along the side, the right side of the heart. Now this artery, this right coronary artery, doesn't just end. It actually ends up on the back side of the heart. This is why I have this picture here. I'm going to show you how this wraps around and comes to the other side. So our right coronary artery goes around the side, which is typically called circumflexing, but we'll talk about why we're not going to mention that. So our right artery comes around and gets onto the back side of the heart, the posterior aspect of the heart. And you can see it runs and then it gives off a branch. So this is its last branch. And I'm going to pause here for a second and say this branch that I'm about to talk about is an incredibly important branch. This was incredibly important because you can't signal a heartbeat if you don't have blood to this structure. But this is an incredibly important branch because of a different reason. So this branch on the back side of the heart, in between the two ventricles, so if you can imagine this is the left, this is the right, it's in between them. That usually is inter, means between, ventricular, interventricular artery, but it's on the back side, so it's posterior. This is our posterior interventricular artery, also known as our posterior descending artery, PDA. People like PDA, well, not everybody. People like calling this artery PDA because it is way, way shorter. But before you do shorthand, always learn longhand. I don't even know if it's called that. But you need to learn the full word first. When you're first studying this stuff, you're writing out the entire word. Because if you don't know what this means, that can get you into trouble. All right, that's just some unsolicited advice. So this is our posterior interventricular artery, which anatomically makes sense, or our posterior descending artery, which also makes sense, but not as much until we learn about the front side. So I'm going to shorthand this because I do know it, but I'm also going to put posterior interventricular. Now, I said this was really important. I'm going to put a star by it. Star. The reason this is important is because of something called dominance. So we're going to learn a rule about heart dominance. Posterior interventricular artery, also known as PDA, determines dominance. Now, what do I mean by dominance? I mean whichever coronary artery gives off this branch determines heart dominance. Let me pause myself here because I get way too excited and never say what dominance actually is. Heart dominance describes which coronary artery gives the heart tissue, the muscle itself, the most blood. Therefore, one coronary artery will supply the majority of the heart. The coronary artery that supplies the most heart tissue with the most blood is the dominant artery. So to determine dominance, you need only look at which coronary artery gives off the posterior interventricular branch, the PDA, because posterior descending branch itself supplies so much heart tissue with blood. Dominance is defined by which coronary artery, the right or the left, gives rise to the PDA. Whichever one does is therefore the dominant artery. And with that explanation, we return to our regular program. So whichever artery, right or left, gives off posterior interventricular artery is actually the artery giving your heart muscle the most blood, which is why it would be the biggest issue if, in this scenario, it is a right dominant heart, because the right coronary artery is giving off the posterior interventricular artery. So if I were to get a clot stuck in the right coronary artery, I am at higher risk for a larger heart attack, because more blood is going to be blocked than if it were in my left coronary, in this heart. And this is when I want to bring up the fact that there are 3 different ways that we can have blood supply here. We can have left dominant, right dominant, or co-dominant. So around 80 to 85% of individuals have right dominant hearts, which means their posterior descending artery comes off of the right coronary artery. It's about 7 to 15, these are going to range depending on which resource you look at, that are left dominant, which means that instead of coming off of our right coronary, the posterior interventricular, the posterior descending artery comes off of the left coronary artery in 7 to 15% of individuals. And then lastly, around 2 to 5% are going to have co-dominance. And that looks something like, if I draw a very, very quick heart, so this is the backside of the heart, co-dominance kind of looks like you have a right coronary artery coming around and you have a left coronary artery coming around, and they both give off sort of a smaller version of this posterior descending artery, and that would be co-dominant. They share the dominance between the 2 arteries. Not very many people in the population are going to have codominance, but I wanted you to realize that that is something that actually exists. But most people are right dominant. That is the most common type of dominance. Point being, it is very important to know which of your coronary arteries is giving off that posterior interventricular or posterior descending artery branch. In our picture, we're going with the most common, so we've had it come off of our right coronary artery. So now that we've covered right coronary artery giving off our SA nodal branch, our right marginal artery down the side of the heart, and then on the back side of the heart giving off our PDA, our posterior descending artery, we can finally talk about our left coronary artery. And I'm going to put our left coronary artery in a slightly different color. I'm going to put it in pink so that we can differentiate these 2. Now the left coronary artery is interesting because when you look for it on the heart, you can't actually see its origin right away because it starts deep to or posterior to the pulmonary trunk, coming directly off the aorta. So I'm going to kind of draw it in a dotted line, because if you want to find it in lab, you got to look under your pulmonary trunk. And then we're going to see it kind of come out right beneath our left atria, and then it is going to branch like so. So this is our left coronary artery, and now I'm going to add a section where we can talk about left coronary artery branches. I'll write it over here. So our left coronary artery is going to have a couple branches. On a right dominant heart, a left coronary artery doesn't have very many branches because it doesn't have this posterior interventricular branch. So we're going to talk about really the 2 artery branches that you need to know. One of which is very important and known widely is this one. So this is our number 1. After we come off of the aorta behind the pulmonary trunk, we're going to pop out here and immediately give off a very large branch down the front side of the heart, down the anterior surface, sort of splitting it into 2. It is actually running just in between both ventricles. So this would be our right ventricle, this would be our left ventricle, and this artery is running in between them. We learned the name of this artery is based off of that interventricular septum, and so is this artery. But just like the back one, this one also has 2 names. So let's write them over here. So this artery is known as either the left anterior descending artery or the anterior interventricular artery. So this is the left anterior descending artery, also known as the LAD, or the anterior interventricular artery. This we're going to label on here as LAD because that is the most common way people refer to it, and it's also how I'm going to teach you the acronym that helps you remember the cardiac veins that run with these arteries. Now, left anterior descending and anterior interventricular artery, remember when you're first learning them, write out their full names or you're going to get to the test and you don't know what LAD means. First branch, LAD. Commonly blocked. That's why I said it was usually one people know, is because this is sometimes referred to as the widow maker, because a blockage in this artery can cause someone to become a widow. That's a terrible thing to think about, but it is something that you might hear people say, so I wanted to mention it. So the LAD is on the front side of the heart, in between your two ventricles, left anterior descending artery. Now, if we follow our left coronary, it's going to go off to the side and it's going to go around the heart to the back side. For some odd reason, while we don't name this portion of our right coronary artery, we do name this portion of our left. I will seriously never understand why. But our second branch is our left circumflex artery. So our LAD comes off and then our left coronary continues and goes around the side of the heart to get to the back side, and that portion is known as our left circumflex artery. So the portion that goes around the heart, circles it, circumflex, is our left circumflex artery, which is our second branch of our coronary artery. Now, usually, and I'm going to make it look better, there's like a little branch that's like an accessory posterior descending artery or something like that that comes off of our left coronary, and it kind of just ends. So I'm just going to stick that in there for the sake of accuracy. I want to back up and just say a couple things that I think are important. This is a perfect world with a right dominant heart. And this is what is supposed to be there. So this is best case scenario. This is my map. But the reality is arteries are the most variable structure in the human body. So when you look at heart arteries, you're going to see a lot of variation. You have to go with an ish and what's supposed to be there. On your practical exams, they're not supposed to tag variation unless it's very, very common variation and you can figure it out. So if you know what's supposed to be there, you should be able to reason your way through. Now, do remember that a left dominant heart would actually have a left circumflex that then gives off this posterior descending artery. So that's something that can happen. You just have to be able to orient correctly, and then you can figure it out. Sometimes, and I'm going to add them in now, maybe I'm going to make them a different color. So technically, this portion of our right coronary artery would be a right circumflex artery. It's just not one that they ever tag. So that does exist though. And then likewise, there could be an artery that comes down from this left circumflex artery along the margin of the heart, and that would be known as a left marginal artery. So I just want you to know those definitely exist, and there's lots of accessory branches, and there's lots of branches to atria and ventricles. We just don't name them in this. And now I'm actually going to delete those orange ones because we're going to talk about veins next, and I don't want you to get confused by the veins that run with these arteries. Okay, so now that I've erased some of that stuff so that we can focus in on the cardiac veins. And our cardiac veins, I actually love this because there's a really easy acronym, a couple acronyms, for you to remember which veins run with which arteries, because the common thing that we do on a practical exam is because the veins are hard to find because they're so flat and kind of structureless, we usually tag an artery and then we just ask you in a question tag which vein runs with this tagged structure. So you need to be able to identify which veins run with which structures, even if they aren't able to tag them. With that in mind, we're going to make kind of a little chart with our acronym, and we're going to start with the left anterior descending artery or anterior interventricular artery and discuss which vein runs with it. And we're going to do it this way. So I'm going to put the artery name here, runs with the vein here, and then how I remember, which is usually a phrase or something along those lines. And we'll kind of make a chart. So our LAD, left anterior descending, runs with the great cardiac vein. The great cardiac vein. So I'm going to put it, they'd run right next to each other. And then the great cardiac vein is actually going to wrap around as well to the back side. So the great cardiac vein, how do I remember it runs with the LAD? Well, you can say the phrase, He's a great lad. What a great lad, or something along those lines. As long as it has great lad, you can remember that the great cardiac vein runs with the LAD, the lad. So we got our great cardiac vein, and I said it wraps around to the back side. So the great cardiac vein is actually going to wrap around here as well, and then drain into this structure that I haven't talked about yet, but we'll be getting into, well, I've talked about it in a different video, and I just want to make sure we're always connecting these things. So we're going to talk about what that structure is later, but we can see our great cardiac vein actually runs all the way around and dumps into that structure. Let's talk about this marginal artery. So our right marginal artery, not our left, our right marginal artery, which might be why we never mentioned that left one. Our right marginal artery runs with a vein. And that vein is called the small cardiac vein. How do I remember that? Well, when you're marginalized, when you're put on the margin and you're marginalized, you're made to feel small. So small with marginal artery, because when you're put on the margin, when you're a marginalized group, you're made to feel small. So that is how I remember the right marginal artery runs with the small cardiac vein. Small cardiac vein is also going to loop around to the back side. Goes into that structure I haven't mentioned yet. Hopefully some of you know what it is. There's one more vein that is related to these arteries, and then there's another vein that's not as related to these arteries that I'll mention, and then we'll be done. Running with our posterior descending artery, so our PDA, we have another vein, and that vein is called the middle cardiac vein. I have two ways of remembering this. Don't get in the middle of PDA, meaning, for those who haven't put it together, which is implying that you should not get in the middle of public displays of affection. PDA. I also think that's just good life advice, but don't get in the middle of PDA, or middle children are in the background. I don't even know if you can see what that says, but it's to say, if you're a middle child, you're on the back. Posterior descending artery, middle cardiac vein. That's two ways to remember that relationship, and this way we can remember all the veins that run with the arteries so that if they're tagged in lab, we can always identify them. Middle cardiac vein with the PDA. Now, where are all these guys draining? Into this structure in between the left atria and the ventricles below. Left ventricle, right ventricle. This structure here, this is the coronary sinus. So the coronary sinus is a big vein that is going to allow the small, the great, and the middle cardiac veins to drain into this sinus and then dump its contents back into the right atria. So this has an opening into the right atria. The IVC, the SVC do as well. Coronary sinus is going to drain into the right atria. It's actually draining all of the heart muscle tissue that has just been supplied by those coronary arteries. So the very last vein is called the oblique vein, or the oblique vein of the left atria. Oblique vein of Marshall is another one. So basically what you need to know about this vein is that it comes from our left atria and drains into the coronary sinus. As an adult, you might see it. It's a very small vein. It gets a lot of press, let's say, because it used to be important when you were a fetus. I go on and on about this just a little too long, so here's everything you need to know. The oblique vein used to be the left superior vena cava. That's right, you used to have a left and a right superior vena cava, but then you grew up. And that left SVC did too, and should have become quite small, ligamentous, and now the remnant structure of that left superior vena cava is the oblique vein, and it's just draining the left atrium of the heart at this point as an adult. Sometimes they persist, but it's not very often. So those are all the veins of our heart, as well as the arteries of our heart, a way to remember which one's one with which, and hopefully you now have a better understanding of coronary arteries and cardiac veins. Thanks for watching. I hope this video helped you learn, and please don't forget to like, share, and subscribe to the channel. I will see you in the next video. Toodaloo!